សូមអរគុណនេះបន្តទៅខាងអ្នកគ្រូសូមជំនាញនិងគណៈក៏ដូចជាយើងស្វាគមន៍ទៅដល់ដរយូនដែរ Welcome
Hello, hi everyone.
Can you wear the mic?
Okay. These make me nervous.
Oh,
Like you're nervous.
hello.
Okay. So is it, we're going to translate or should we do English? Okay, hi everyone. Thank you very much for inviting me here. I feel very, very lucky and honored to be able to do this presentation and do this workshop today. Well, I have some things we're going to be doing together today, but before I do anything, I just wanted to just ask a couple questions, okay? So I'm going to be presenting third wave behavior therapy, and there's three of them. One is acceptance and commitment therapy, the other is functional analytic psychotherapy, and the third one is dialectical behavior therapy, DBT. So I'm kind of curious, how many people have had training or have experience with acceptance and commitment therapy so far? Excellent. Good. And how many people have had experience or training with CBT, like cognitive behavior therapy? You've learned that. Okay. And let's see, what else? Dialectical behavior therapy. Okay, DBT, yeah. And then what's left? Psychodynamic therapy. Okay, so mostly, a little bit, so mostly people have learned kind of CBT, cognitive behavioral or dialectical, but nobody learned ACT so far. Good. So here's something to think about. Your CBT? You learned CBT? Mm-hmm. So this is what the people in CBT will say, and ACT will say. Oh, first rule, acceptance and commitment therapy, people who learn it, they call it ACT, like acting. ACT. So if you say, you have to, from this day forward, say, I learned ACT, not ACT. Then everyone will know you're innie, not an outie. So here's something to sort of get you thinking. Do you mind if I pick on you?
Sure.
Yeah. So you learned CBT. So if a person has an idea that I feel like I'm a bad person, I'm not really a good person, how would you handle that in CBT?
Yeah, we will have to have that person to change to new thought.
To a new thought?
Yeah.
Great. That's exactly what they would do in CBT. And you know what the ACT people say? That's the exact wrong thing to do.
Yeah, you need to do some activity to change that, right?
No, that's even more wrong.
Okay.
That's even more wrong.
Yeah, yeah.
So that's it. So I want you to be thinking about that. It's kind of an interesting idea. ACT is very different. It's a behavior therapy, but it's really different from traditional cognitive behavior therapy. In fact, many people who do ACT will say, the way they're doing CBT is wrong. But right. But wrong and right. So I'll explain that. So the first thing, okay, yeah. So first I want to say thank you. Thank you for inviting me, GLZ, for coming here. I think it's a great opportunity. I love Cambodia. I came here for the first time in, first, Dr. Sao, Dr. Lei. I met them last year in Thailand. They did a presentation on the effects of marital disruption on mental health among Cambodian people. And I was at the conference and they did such a wonderful presentation, and in that one presentation, I learned a lot about Cambodia and Cambodian people and how mental health needs in Cambodia. I thought, I've got to get to know these guys. And so we met afterwards, we talked and developed, an idea that we could work together on research and work together on mental health treatments in Cambodia. And since then, we've been working together, writing papers, doing research. And I've come to learn more and more about Cambodia and Cambodian people, and you have a beautiful country, beautiful people, and I'm just really honored to be able to work with you today. So I really thank you for having me, and I thank you too for being amazing teachers. Yeah, we'll give them, yeah. So I usually do a thank you to everyone that allowed me to be here. So I have colleagues who are here, so I'll just talk about each one of them briefly. So What we're doing here is found on research from my home university, and I work in Thailand, and also Duke Queensland University, so we get funding from them to do research on how to do new therapies and how to evaluate them. Oh, yeah, I guess. This work is funded by Fulbright, which until Donald Trump was doing okay. Since Donald Trump, not okay. I'm a little depressed about America. These are some of the colleagues that we work with. Here's when I met these guys in Thailand, and this is the work they did. They got an award for best presentation. These are my Thai colleagues, and let's see, we can go. These are all the students that we work with on research and teaching, so I like to acknowledge them. They're from Duke University and Duke Queensland University, and these are my students in America. They're doctoral students. This is Chiang Mai, Chulalongkorn. And let's see, people that I've learned from. I like to go to the monks and talk to them and learn from Buddhist principles, because I feel many things that we're learning about that's new in psychology is really old in Asia. So Western people are like, wow, maybe we should be mindful. And then the monks have been saying that for maybe 2,000 years. So Mary, like, oh, so I think it's nice to be able to learn these things. I also like to say thank you to my teachers, my students. I don't know why I took a picture of the monkey, but I think monkeys are cool. Yeah, okay. These are my children. I always have to thank my children. This is when they were little. Now they're big, but I still think of them as little. I never stop thinking of them as little people. And then my next is I thank coffee. I love coffee, and I think coffee loves me. We have a mutual relationship, I believe. Okay, so I think what I would like to do first is maybe just a little different, but I just ask you, so what would you like to learn today? And yeah, I'm just gonna do that. What would you like to learn? What's that?
Learn act.
Learn act, good. Okay, so you would like to learn act. So I think I'm gonna try to show some ideas about this. I'm gonna try to show how we do therapy in teaching you how to do act at the same time. I think I can do that. So if I was assessing that, so you'd like to learn act, what would that mean to you? What does it mean to learn act?
I think that is for me that is a new approach that part, as you said, that part from the CBT or something like that.
Right.
I really get curious to know what is it, and how the therapy of the acceptance and commitment look like.
Okay.
How is different between the CBT counseling as well as compared to the ACT.
So learn how to do ACT so that you can use it with people that you work with and make that up. Okay, that sounds great. I think we can definitely do that. By the end of today, you will have skills in how to do ACT, and we will make that work for you. But I have a bigger agenda, so let's see what else. I guess. Oh, by the way, this is where I'm from. Here's Ohio. That's what Ohio looks like, in case you were wondering. And if we have a little time at the end, I'm going to give you a bonus on functional analytic psychotherapy. That's another psychotherapy that's closely connected to ACT, and it's a nice therapy to learn if we have time. So I want to teach you ACT, but I want to do more. I want to change your life. I would like for you after this day to say, I have a new life. In one day. Well, this is kind of an interesting idea, right? But the idea is you will have a life-changing experience today, I think. That's my goal. I really do. And one of the things that you bring up, like in one day, but actually you can change your life in a split second, right? Maybe if we have time, these guys know, I was walking home in Thailand 2 years ago and I got hit by a buffalo walking home, and that changed my life pretty quickly. Got hit by a buffalo, 2 seconds later I thought, I have a new life, and got hit by a buffalo. To enjoy the workshop and become better people. That's my goal. Okay, so This workshop, even though we have a fairly large group, we find that in teaching ACT, you learn it best through experience, not me talking all the time. And we've done research on this. We had half therapists learn through lecture and half learn through experience, and then we had them do therapy. The experientially trained therapists did better than the lecture therapists, and the clients liked them better than the lecture. So we know that experiential learning is really helpful. So we'll be doing a lot of that today, and some of it can bring up emotions. And so when it brings up emotions, we kind of, some rules we'd like for you to follow. Some of the things we do will maybe make you cry. Some of the things we do will certainly make you feel emotional. And so part of the rules of doing an experiential workshop is to be present, meaning try to allow yourself to experience whatever you experience without judgment. So you may be saying, like, am I doing this right? Am I doing it wrong? Try to not worry about that. Just let happen whatever's gonna happen. So that's number one. The second thing is and this sounds like a bad idea, but it's a really good idea, is to not rescue people. So what that means, rescuing is something we normally do when we see someone who is feeling unhappy or distress or cry or tears. We want to make them feel better. And that's called rescuing. We want to pull them away from their sadness. One of the first rules of acceptance and commitment therapy is there's no bad emotion. There's happiness, sadness, anxiety, depression. They're all just emotions, and everyone is welcome. So if I see you cry and I say, don't cry, I'm rescuing her, but I'm also telling her crying is bad. Crying should not be happening. So we want to not rescue, allow people to have whatever they want to have. Okay, deal? Notice your own reactions to different things when they happen. Notice how you might be judging or evaluating or feeling things, and just notice those things. And then last, I'd like for you to break rules. Break all the rules. By breaking rules, I mean you have a lot of ideas about what's right and wrong, about what should be said, what shouldn't be said, about how to do therapy, about how not to do therapy. And ACT is really all about, I'd say the number one thing in ACT is teaching clients how to break rules, because they come into therapy, which is, I can't do this, I can do this, I can't do this, this is right, this is wrong, this is this, blah, 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 blah. They've built a prison of rules, and they live within that prison of rules, but they're all made up. They say, I can't sing. I worked with a woman who said, I can't sing. I said, really, you cannot sing? Like, not even like, happy birthday to you. She said, no, I do not sing. So she had a rule, which is, I don't sing. And she lived by that rule. Of course she can sing, but she has a rule that I cannot sing. So with ACT, we say, well, let's sing together to break the rule. And that's one rule, and then we start breaking all her other rules, which is, I'm dumb, I'm not smart enough, I'm not good enough, I'm not pretty. All these rules about herself. We want to break rules. So that's what we're doing in ACT. Okay, so what's going on with mental health, I think, and coming to your idea of ACT is there's a kind of we're going from CBT to third wave behavior therapies. And some people are calling this a major shift in psychotherapy. And I think it is. I think the third wave therapy is a new way of thinking, and there's a lot of research on it. So just to give you a little researchy stuff, there's over right now probably 1,000 randomized clinical trials on ACT showing that it's an effective therapy, so a lot of research. CBT is also effective. I'm not saying it's not, but it's a new way of thinking, and it does have a lot of research support. So that's why I really like it. And it's a paradigm shift in the sense that it's treating mental health symptoms in a really different way. And it's non-diagnostic, meaning we don't diagnose, we hardly ever diagnose. It's trans-diagnostic, meaning you can use it for many different disorders. And it's non-symptomatic focus, meaning we don't try to reduce symptoms. We're not trying to make people not feel bad. What we are trying to do is help people live good. And I'll explain that more. It's also another thing going on in mental health, which is so important for you guys. It needs to be more global, and we need to move away from sickness models and more towards kind of positive, health-oriented models rather than calling people sick and disordered and broken. We're just really not trying to do a lot of that kind of work. Okay. So one of the things that comes up in ACT, this is what I'll say to patients many, many times. Your solution is the problem. Over and over again. Or if you don't want it, you have it. The more you try to control this thing that you have, the more loss of control you're going to get. So these things sound odd, but I'll kind of give you examples of how this might work. Solution is the problem. A good example of this is, let's say, you'll see, I don't know, if I'm working with a college student in a relationship, maybe the boy is insecure. He doesn't think his girlfriend loves him. So, he's like sitting there on his phone. And she goes, well, I'm going to go out with my friends tonight. I'm going to go out with my friends. Anxiety shows up. Uh-oh, she's going out with her friends. Now he's worried that she doesn't love him, and maybe she's going to find another boy, right? Gets anxious. His brain says, I've got to do something. So what he does is he starts texting her, like, where are you? What are you doing? His solution is to check on her so that he can save himself from losing her. She's like, hey, I'm out with my friends. You don't have to text so much. That makes him get more anxious. His solution to that increased anxiety is to ask more questions. Who are you with? Is there a boy there? She responds back, this is not good. You're smothering me. Your texting is not good for our relationship. His solution to that anxiety, text more. So he's getting feedback from the person in his life that he loves that this thing you're doing is going to make me not love you. And his brain comes up with this crazy idea. The solution will be to do more of the thing that's driving her away. His solution is the problem. And more, and quite often you'll hear patients engaging in behaviors that are producing the exact opposite thing that they want. And that's interesting, right? Why would a good human brain that can build this building come up with super bad ideas for how to deal with emotions? Interesting, right? So we're really interested in this idea of why we have bad solutions to problems and helping clients break free of this strategy of unhelpful thoughts. Okay, so another, if you don't want it, you have it. And I can't do this, but I guess I could. All right, I'm gonna try to do an experiment. I don't know if I can do an experiment here. Okay. Well, I can't do the experiment. They've done cool research where you're half the group, and I'm gonna say for the next minute, you guys try not to listen. For the next minute, I don't want you guys to think of elephants, all right? And I'm gonna say start, and for a minute, your job is to not think of an elephant ever for 1 minute, okay? And then this group gets told nothing. I say, just think about whatever you want for a minute. So if we did that experiment, which group do you think thinks the most about elephants? Exactly. Trying to not think about elephants produces thinking about elephants. That's kind of one of the ideas of CBT. If you say you need to tell yourself that you're smart and confident, requiring yourself to think I'm smart and confident also makes me think I'm not smart, I'm not confident. Trying to control not having a thought, not having an elephant produces elephant. Trying to think that I'm not dumb, not stupid, not smart makes me think I'm dumb, I'm stupid. Interesting, right? We don't want it. The more we push at it, the bigger it gets. That's interesting. So this is like a question, like why does the human mind do this? Like it's kind of a weird thing that we do. It's just unusual. I'll try to explain that. So the other kind of theme today, and then we'll kind of get more experiential, is this is so wonderful that you're here because psychology is weird. Weird meaning Western, educated, industrialized, rich, democratic. One of the big things that's happening in psychology is beginning with Freud, guess who was doing all the psychological research? People like me, white people. White people in America. Right now, if you look at research in clinical psychology or all psychology, 94% of it is produced by white people in America or Europe or Australia. 94% of all articles is coming from that part of the world. 94% of the people in the studies are white, educated Americans, Australians, Europeans. 94%. Now that would be okay if white, Western, educated, rich people were normal. But we're not normal. We're weird. 7 billion people in the world are not Western, white, educated. 7 billion out of 8.5 billion. We're a minority and we're not normal. So almost all of psychological research is based on not normal people. And everyone now is recognizing that this is not a good idea. This is a problem. This is a really big problem. And there needs to be more global research, more voices from Cambodia, people from around the world generating ideas to improve psychology to make it more global. And ACT, in many ways, is working because it has ideas that come from Cambodia, Thailand, India. The main ideas come from Eastern philosophy for sure. So we don't want to be weird, and I'll kind of show you a little bit more on that. So CBT, one of the difficulties with CBT is it's very weird. So here's the ideal life in America. I live in my little farmhouse with my little farm and I have my tractor. I'm all alone, I'm independent, I stand alone, I don't need anyone. I'm a I, me, self. That's healthy in America, to be a person independent, separate, non-interacting, completely self-sufficient. And psychotherapy in America says you need to be independent. You need to be self-reliant. You need to have self-confidence, self-efficacy, self, I. And the more you can be an island, the more healthy you are. That's the American way. But here, this is a picture of Vietnam, but I'm sure it could be Cambodia, it could be Thailand. Here it's wonderful, right? People have their fields, very organic, straight lines. And they work in the field, and then at home they come and live with other people, connected with other people, interacting with other people, sharing, having community relationships. And is this what these people want? No. So when we're trying CBT to do this for people who live like this, maybe not such a great idea. Maybe not a really good idea. And in fact, it probably is better to go the other way around. This teach these people how to get along with other people, right? We need to move it back the other way. So CBT in a lot of ways has some trouble because it's very weird and teaches a lot of self. And ACT really moves away from self. In fact, ACT you'll be familiar with kind of is connected to Buddhism, which is no self-attachment. The more you can get rid of self, the healthier you are. And that's kind of like an ACT model. Okay. Just a couple last things. Here's some data. The dark colors show where research in clinical psychology and in all psychology is being conducted. And then the light colors are where there's very little research being conducted. And again, you can see this weird problem. Most of the research is being conducted in Europe, America, Australia, and then where most of the world lives, there's very, very little research. So we don't even have good knowledge of the best treatments outside of America. And that's why, there's a real need to sort of create voices from Asia in research to educate and teach the rest of the world how to live. The Westerners can't do it. And I think that's really a big deal to me. It is a really big deal. That's why I'm here. That's why I feel really happy. Okay. So we're moving from CBT to this Eastern perspective, which is ACT, connected to Buddhism. And I'm going to kind of talk about the brief history of the modern world. But before we get there, I think I'm going to start getting boring. So I don't want to get boring. So I think we better start some things, don't you think? All righty. Before I get boring. So one of